Hello viewers, I am Dr.G.B.Prasad, Professor and Head Department of Anatomy, Motiwala Homeopathic Medical College, Nasik. We will discuss in this lecture the external features of cerebrum. You know cerebrum is part of forebrain. Forebrain consists of cerebrum and diencephalon. The cerebrum is consisting of two cerebral hemispheres separated by a longitudinal fissure. This longitudinal fissure separates the two cerebral hemispheres. The right cerebral hemisphere and left cerebral hemisphere are separated by this longitudinal fissure, but both of cerebral hemispheres are continuous with each other or connected by the corpus callosum inferomedially that helps in coordination between the right and left cerebral hemispheres. The external features of the cerebral hemisphere consists of three surfaces. They are superolateral, medial and inferior surfaces. There are four borders. The four borders are superomedial border, inferolateral border, medial orbital and medial occipital borders. There are three poles: frontal pole, occipital pole and temporal pole. And each cerebral hemisphere consists of four lobes. The lobes are frontal, parietal, occipital and temporal. So these are the features of each cerebral hemisphere. Each cerebral hemisphere consists of three surfaces, four borders, three poles and four lobes. These are the differences between three different surfaces of cerebrum: superolateral, medial and the inferior surfaces. Now coming to superolateral surface, when you hold the cerebrum or cerebral hemisphere in your hand, the superolateral surface lies in your palm. It is convex laterally and lies between the superomedial border and inferolateral border. Now this is the medial surface of cerebrum. It is flat and vertical. You can see the corpus callosum which connects it to the opposite cerebral hemisphere. This is the inferior surface of cerebral hemisphere or inferior surface of the cerebrum. This is a picture showing both the right and left cerebral hemispheres and also the other parts of brain. The inferior surface of cerebrum consists of two parts: the orbital part, which is called orbital surface, and the tentorial surface, which is present posteriorly. Both these surfaces are separated by the presence of the stem of the lateral sulcus. The stem of the lateral sulcus, as you can see, separates the orbital and tentorial surfaces on the inferior surface. Now here is a reflection spot. I would like you to answer this question. What are the surfaces of cerebrum and what are the parts of inferior surface? Once you are done with the answer, you can resume the video. Now you must have done with your answer and you must have written that the surfaces of cerebrum are superolateral, medial and inferior surfaces, and you must have also written that the inferior surface consists of orbital and the tentorial parts. Now let us discuss about the borders of the cerebrum. The superomedial border separates the superolateral surface and the medial surface. You can see both superolateral surface and medial surface in the pictures, and you can see the border, the superomedial border separating the superolateral surface and medial surfaces. Now inferolateral border. Now if you examine the inferolateral border, it is not straight. The anterior part is overlying the orbital plate of the frontal bone. This part of the brain is separated from the orbit by the orbital plate of frontal bone, and this part of the inferolateral border is called as superciliary border. You can see this is the superciliary border. This is superciliary border. So the anterior part of the inferolateral border is called as superciliary border. Now if you see the posterior part of this inferolateral border, it is notched about 5 centimeters in front of the occipital pole, and it is called as preoccipital notch. This is another feature present on the inferolateral border of the cerebrum. Anterior part is called as superciliary part or superciliary border, and the posterior part has a notch about 5 centimeters in front of the occipital pole, which is called as the preoccipital notch. Now this is the inferior surface, wherein you can observe the other two borders. This is medial orbital border. This medial orbital border separates the anterior part of the medial surface from the anterior part of the inferior surface. This is medial orbital border. Now here this is the medial occipital border separating the tentorial surface of the cerebrum from the medial surface of cerebrum posteriorly, and this is called as medial occipital border. So now, what are the borders of cerebral hemisphere? You must have seen that there are superomedial border separating the medial and superolateral surfaces, inferolateral border separating the superolateral and inferior surfaces, consisting of two parts, that is superciliary border, and in the posterior part there is preoccipital notch. Then you must have also observed the medial orbital and medial occipital borders. Now coming to the poles of the cerebrum presents three poles. Anteriorly there is frontal pole, posteriorly there is occipital pole, and in between these two poles, inferiorly, there is another pole called as temporal pole. The frontal pole lies in relation to your forehead, and occipital pole in relation to the occipit, and temporal pole lies behind your orbit in the middle cranial fossa. Now coming to the lobes of cerebrum. The lobes of cerebrum can easily be understood on the superolateral surface by drawing two imaginary lines. And we will see how to draw those two imaginary lines. There are four lobes: frontal lobe, parietal lobe, occipital and temporal lobes. This is the central sulcus. You can see the central sulcus cuts the superior-medial border about a point behind the center of that superior-medial border and extends downwards to the posterior part of stem of the lateral sulcus. Now you can see the lateral sulcus. This lateral sulcus begins on the inferior surface and extends on to the superolateral surface of the cerebrum. Now these two sulci, plus there is another sulcus called as parieto-occipital sulcus, which is present over the superomedial border and in front of the occipital pole. You can see this is the parieto-occipital sulcus. This parieto-occipital sulcus, central sulcus, lateral sulcus, that parieto-occipital sulcus, these are the three sulci that form important landmarks for division of cerebrum into different lobes. There is pre-occipital notch. This we discussed while discussing the borders of the cerebrum. This is the pre-occipital notch that you can see there. This is the pre-occipital notch. Now what we have to do is, we have to draw an imaginary line extending from the pre-occipital sulcus to the pre-occipital notch, separating the occipital lobe from rest of the cerebrum. And we require another imaginary line extending from the posterior part of lateral sulcus to the first drawn imaginary line. Now you can easily identify the four lobes of this cerebrum. What lies in front of the central sulcus above is the frontal lobe. What lies behind the central sulcus and the pre-occipital notch, and the second imaginary line is parietal lobe. What lies behind the first imaginary line is the occipital lobe, and you can see below the second imaginary line, first and second imaginary lines and the lateral sulcus, there is temporal lobe. So now these are the different lobes of cerebrum. What are the lobes of cerebrum? The frontal, which lies in front of the central sulcus; parietal, behind the central sulcus and in front of the first imaginary line, or in front of, you can say, pre-occipital notch, and above that second imaginary line drawn from the stem of the lateral sulcus to the first imaginary line, and then temporal lobe line in the lower part, and occipital lobe that lies behind the first imaginary line, drawn from the pre-occipital notch to the parieto-occipital sulcus. Now, this is how you can revise. The cerebrum consists of two cerebral hemispheres divided by the longitudinal fissure into right and left cerebral hemispheres. The three surfaces of cerebrum which we discussed are superolateral, medial and inferior surfaces. The four borders which we discussed are superomedial, inferior medial orbital, superomedial, inferolateral, medial orbital and medial occipital borders. The poles that we saw are frontal pole, occipital pole and temporal pole. And the four lobes are frontal lobe, parietal lobe, occipital lobe and temporal lobe. So this is how we can describe the external features of cerebrum, and we will see in our next lecture the further details about the white matter and interior of the cerebrum. Thank you.